Assalamu alaikum dear students. Today we will discuss advance in MLT MCQs part 1B and DNA adenine always pairs with dash. Option A cytosine, B thymine, C adenine and option D uracil. Correct option is B thymine. The first step of PCR is dash. Option A denaturation, B annealing, C primer extension and option D none of these. Correct option is A denaturation. Subscribe now and press the bell icon. Never miss an update from a technologist. The patient sample required for RIA is option A blood, B serum, C body fluid and option D all of the above. Correct option is D all of the above. PCR is used to dash. Option A amplify the gene of interest, B construct a repeat map, option C detect the presence of transgenes in an organism and option D all of these. Correct option is D all of these. In some cases of leukemia with very high WBC count, removal of the excess leukocytes may help to prevent complications of option A infection, B inflammation, C thrombosis and option D edema. Correct option is C thrombosis. The RIA techniques are introduced in option A 1960, option B 1977 and option C 1988, option D 2012. Correct option is A 1960. The northern blotting hybridization technique is called dash. Option A protein vitamin hybridization, B RNA DNA hybridization, C RNA RNA hybridization and option D DNA DNA hybridization. So the correct option is B RNA DNA hybridization. RIA technique is the competition between option A antigen and antibody, B antibody and antibody, option C antigen and antigen. So the correct option is C antigen and antigen. PCR is used in dash. Option A site specific recombination, B site directed mutagenesis, C site specific translocation and option D both A and B. So the correct option is B site directed mutagenesis. At increasing concentration of unlabeled antigen, an increasing amount of radioactive dash is displaced. Option A antigens, B antibodies, C complements, option D lysis. So the correct option is A antigens. To measure radioactivity, an RIA technique is used. Option A Sysmex, B Hitachi, C gamma meter. So the correct option is C gamma meter. The process of apheresis involves the removal of option A whole blood, B antigens, C antibodies and option D complements. So the correct option is A, whole blood. The process of apheresis has become essential in providing blood components for option A, study, B, therapy, C, infection, option D, necrosis. So the correct option is B, therapy. In apheresis, albumin is not always readily accessible, and it is option A, inexpensive, B, expensive, C, disposable. So the correct option is A. An apheresis removal of platelets can help to avoid complications of thrombosis and dash. Option A, disease, B, bleeding, C, cancer. Correct option is B, bleeding. The purpose of therapeutic apheresis is to remove a component of blood that dash contribute to the dash state. Option A, abnormal and pathological, B, typhoid, C, disease, and option D, heart attack. So the correct option is A, abnormal and pathological. Thank you for watching my videos.